Well, hello, everybody. Welcome to our Starter Sit podcast. This is going into week 12 of the NFL. And I have to say, first of all, happy Thanksgiving to you all out there. I hope you have a wonderful day and enjoy your family. Thanksgiving night, the Seahawks have a football game. We're excited here in the Puget Sound regarding the Seahawks playing on Thanksgiving Day. We're, like I said, in week 12, Starter Sit. We're going to talk about the previous week's injuries. I'm Shannon O'Kelley, physical therapist, and he's Dr. Hawkins. He is an orthopedic surgeon and sports medicine specialist and a prognosticator extraordinaire. He's done a great job with us when we talk about injuries and who's going to start and sit. How you doing?
I'm doing outstanding. Just like you said, really excited for Thanksgiving and a unique experience this year where we do get a Seattle game on, a Seahawks game on Thanksgiving. So we get to finish off the day with that evening game.
Yeah, evening game. Probably take a nap at halftime most likely. And we've got the 49ers, Seahawks against the 49ers. These are the top two teams in that division, I believe. And we're neck to neck. Speaking of necks, you remember Christmas Vacation? Save the neck for me, Clark. You remember that? I got to throw that out.
Absolutely.
It's playing right. Christmas Vacation is playing right now. It's one of my favorite holiday shows. Joe Burrow's not having a great Christmas vacation. This guy, man, my gosh, he was hampered by a calf injury early in the season, limping around, but still played. Last week when they were playing, I believe they were playing the Ravens, if I remember right. He looks like he has a wrist injury, and it's significant enough an injury where they're talking about a ligament and they're talking about season ending. So you're the surgeon. What's going on there?
Yeah, this one was cloaked in a little bit of secrecy. The NFL's getting into this sort of investigation, saying maybe he had an injury leading into it. That being said, we won't speculate on that. The idea that he's having potential surgery for this and the way that he had difficulty gripping the ball, the general consensus right now is that he tore what's called his scapholunate ligament. So when you look at your wrist, for the listeners out there, it's a pretty complex structure. There's essentially 8 small bones that make up your wrist joint that allow things to kind of move and to, provide the ability to stabilize the hand to grip things. And so the scaphoid and the lunate are both 2 of those central bones that come right up against your forearm bone, the radius. And that ligament between them keeps things stable, just like the ligaments we talk about in other parts of the body. So it's a very unusual injury to sort of see in an athlete that maybe didn't directly land on it. And I think that's why there's some speculation that did he have something going on? Had he tweaked it earlier? And then when he did have contact with one of the I think it was Jadeveon Clowney, but I'm not sure about that. When he did have contact in the game, did that result in it actually tearing completely? And so then when he tried to grip a ball, you saw when he tried to sort of throw and release on the sideline, I mean, he just literally dropped it out of his hand like a hot poker. So that's something, if he were not a quarterback, I bet they would just be wrapping this thing up and they would be playing him through the end of the season, and he'd get reconstructive surgery if needed in the offseason. But it's a debilitating thing for somebody who's got to grip and throw. That being said, it is something that can be fixed. It is something that has good results in fixing it. They've come a long way. The hand surgeons have with fixing these injuries, and they actually are doing it now sometimes with a little piece of suture material that sort of reinforces the repair, so even the rehab can go a little bit quicker, kind of like we've seen with some of those like ankle and elbow injuries over time. So as you know, and as you said in the beginning, he's unfortunately going to be out. And he will be a sit for this week, but it's a very unusual injury, and it's caused a lot, like I said, a lot of speculation about, whether the team was sort of covering up this injury a little bit going in.
Well, no, I saw the injury. I saw when it happened. He did hit someone. I'm not sure if he hit a player or the helmet or whatever, but he immediately grabbed his hand. He might have been sacked. I kind of vaguely remember this happening, but you're right. He went over the sidelines. He was trying to grip a ball, and he just dropped the ball and shook his head, and he immediately went in the locker room, and I kind of suspected something was going on with the hand or a wrist. Very complicated area of the body. Here here at IRG Physical and Hand Therapy, I emphasize hand therapy. We have a lot of certified hand therapists, and they're special. They're special people, and they treat those complex injuries, but it can be repaired, and he will be back next year. But he is out this season for sure. Okay, all right. Here's a local person close to our situation here. Geno Smith. I saw this injury too. He, I think he got sacked or something like that. He basically, you could tell he got a contact in the posterior elbow and went out. They put a compression sleeve on him. He came back in and he threw a pretty good ball. So they're thinking he's got an elbow contusion, maybe a bruised, tricep insertion, the tendon there. What do you think Geno Smith's going to do?
Yeah, I think he's fortunate. They did get him some advanced imaging and saw that there was no structural damage to the tendon itself. Obviously, a complete rupture there would have been a season-ending injury for him, or even a significant partial rupture would probably sit him for 4 weeks on IR. But it looks as though structurally things look good. Probably just saw some soft tissue swelling right at that bottom, just like you said, the insertion of where the end of the muscle becomes the tendon, the ropey part, and then attaches to the bone. So as long as he's been able to work on his flexibility and his strengthening this week, which it sounds like he's been doing, I think they're just restricting some of his reps in practice. And I anticipate he'll be a play, especially in such a big game this week. And he's a gamer. He realizes this is his second chance on success in his career. I think he's going to push hard to keep playing and get the Seahawks a win and hopefully start to move up the standings there against the 49ers.
Yeah, I would agree. I think he's going to play. Obviously, like I mentioned, I watched that game and he got hurt and he set maybe 2 series. Locke came in, but they put a compression sleeve on his elbow and he came back in and he threw a nice ball. It was about a 20-yard pass and it was a rope. So I think he's got the ability to throw, but again, you got to keep an eye on him, but he will play for sure. I agree. Here's another guy that's kind of been just struggling this season, has had some bad luck. I believe Kupp, wide receiver, Los Angeles Rams. I think he was out for the first 5 weeks of the season with a hamstring strain, and now he has this ankle sprain that happened in the game last weekend. And, receiver injured before. What are you thinking? I mean, you think he's going to play or is he going to be out?
Yeah, I think, we're starting to see what, he's a bit of a local hero around here from his college days. And the reality of it is I think you're starting to see the older receiver getting nicked up. Those soft tissue injuries are catching up with him. The good news, again, they tossed that important low ankle sprain term out there. So that usually means he's got some soreness, he's got some weakness down there, but he doesn't have that gross instability between the two lower bones, the tibia and the fibula. So I think he's going to be somebody, they'll probably practice him this week. They'll tape him up. He'll go through his pregame workout, and I believe he will start. The question is just, will he make it through the entire game? Because he's going to be one of those guys, he's going to have a narrow fairway, so it's going to be easy for him to end up in the rough. Yeah. So he's going to be somebody, I would start him. He can be super productive when he does well. But it's always, he's, one of those guys we're going to start watching him every week to see if he can play a full game.
Yeah, he's pretty important to them because I think they have another receiver we probably should talk about right now. Running back here, Los Angeles Rams. Let's jump to this player, Kyren Williams, running back, Los Angeles Rams here. He's supposed to return from IR, and he's been on IR with an ankle sprain. So we're talking about Kupp playing, but keep an eye on him. If he's on your fantasy team. But is Kyren Williams' return going to help them in the running back position? And he's coming back from an ankle sprain. He most likely is going to play, but probably one of those players you got to watch. What are you thinking there?
Yeah, exactly. And this one hits near and dear for me. He is on my fantasy team. Okay. So he was a super producer. And when he went out, my backup running backs were left a lot to be desired. So he's due to come off of IR this week. All the indications are that they're taking away that designation today, which means he can practice and play going into this weekend. And just like you said, he's going to be complementary to their wide receivers and their passing game. He does have a pretty good ceiling with regards to he is a good receiver out of the backfield as well as being a good running back. So I think they've done the right thing with him. I think they rested him the appropriate amount, and I think he's coming back, not like working himself back in like you see Justin Jefferson is with Minnesota, where he's kind of he's slowing himself down because he doesn't feel he's ready to go. I think Kyren is going to be a full play this weekend. And even if he's not as productive as a running back, I think he will catch some passes. He'll get positive yardage. And so for the fantasy guys out there, myself included, he is a start this week.
He is a start. Kyren Williams, running back, Los Angeles Rams, is a start. Cooper Kupp, just to go back there, he's got an ankle sprain, probably those low, like he described, a lower ankle sprain. He will play, but keep an eye on him. I mean, do you know, off the top of your head, do you know who they have this weekend, L.A.? I can't.
Yeah, I do not.
They did beat our Seahawks last week on a missed field goal at the end of the game, and so I think they're 5-6 or something. They're like middle of the pack, but they have a chance, so to speak.
They're not the Cardinals. They have a chance.
Yeah, exactly. Yeah, there you go. Okay, Jayden Reed, wide receiver, Green Bay Packers. This is one of these injuries we've talked a lot about. He's got soreness in his chest. He took a pretty big hit. Again, he's a wide receiver. He's got to go up overhead with the ball, expose that chest cavity, so to speak, those ribs. And he sounds like he is reporting some soreness in the chest still. And he may be kind of, what do you think, 50-50? Jayden Reed, wide receiver, Green Bay Packers.
Yeah, I think we're dealing with, obviously it could be a significant injury with regards to that chest wall, but, we talk about the different levels of that. So deeper, we obviously have your ribs and the intercostal muscles between them. But I think his situation is probably a little bit of a pec injury. And so he doesn't have a rupture of the tendon, but it sounds like it's a tear within the muscle of the pec itself. And so just like those like hamstring strains, things like that, it's going to be important for him to have good control of his upper body. And so I think he's going to be probably a sit this week. I don't think he's going to be a go. I think they're going to hold him out and give that soft tissue an extra week to heal. Yeah.
We've had a couple pec injuries. Don't normally see a lot of pec injuries, in most sports, but it's been pretty typical this year. Have you ever, as a surgeon, have you ever seen a completely ruptured pec off? Have you ever seen that?
Yeah, I actually have, and it can happen. It can happen in a few different situations. I've seen a lot of weightlifters do it. Yep. And a lot of times they tend to be sort of like late 30s, early 40s, and they're pushing around a lot of weight, and they get sort of that eccentric load where it's too much weight and it pushes them back. I have had a really young kid who had an acute injury. He actually played collegiately. I think it was his senior year in high school, and he just got his arm caught out the wrong way and completely ruptured the tendon off the humerus. So we had to go in and directly repair that. So complete ruptures in a high level athlete. Probably the most famous guy who actually I think had two of them in his career was J.J. Watt.
Yes, that's right.
Right. So he, and that I believe is kind of one of those things that fed into, him eventually retiring, even though he was still obviously a pretty high level athlete. I think he was just taking such a beating on his body with those injuries. Yeah.
Particularly that defensive, they do that swim move. I can see that being very strenuous on the pec, getting their arm caught behind him and that tension. Interesting. How hard when I've never rehabbed. That's one thing in my career. I've never rehabbed a pec injury, and particularly one that's been completely ruptured. What is that return to play? What is that, about 4 months or something like that? 4 to 6 months?
Yeah, it's come a lot farther recently because they've come up with some really interesting ways to anchor the tendon very securely back to the bone now in a way that it's a very short, thick tendon, and there's not a lot of excursion of your pec, which is nice. Right. So the good news with these is it's almost like rebar within concrete. There's this reinforcement of the anchoring and the suture materials now that's so stout that you can be a lot more aggressive in moving these guys along. I think an NFL level guy, you're right, 4 months probably. A routine person, just getting back into their workout activities, surprisingly, they can kind of do light stuff 2-3 months out and sort of be doing things a lot quicker than they used to be. We used to have to sit these people for 6 to 9 months to let them heal. But like I said, it's come a long way with the advances and much more minimally invasive ways to anchor it.
I'm just thinking to myself here as you're talking about this, because this sounds extremely painful, but I remember back to high school and we do those one max rep days, where everybody come in the weight room when we were doing weightlifting in high school, and you were going to one rep your bench press, and how many guys, I just watched overload the bar, and I'm surprised they didn't rip their pecs. It's pretty amazing. So Mark Andrews, tight end, Baltimore Ravens, cracked fibula ankle ligament injury. I caught this game. I think they cut to it after he was injured. They were talking about his injury, and it was pretty bad. I think they carted him off the field. Would this be an ankle dislocation with the fibular fracture? Is that what happened, or just a hit that fractured his fibula?
Yeah, I think it was the classic thing, Shannon, where he was grabbed at the waist and the guy behind him kind of sat down on the back of his foot and his leg. So it was that very classic where you're like, hey, the foot got externally rotated and the upper body went the other direction. So it was actually good news because his x-rays were normal when they saw him. And so they were sort of thinking high ankle sprain, which again, we've talked about those a ton.
Right.
Those are long recovery, potentially season ending if you need some type of ligament reconstruction. And what happened is that they got the MRI and saw a little non-displaced crack in the fibula. So what ended up happening is that force of that twist happened at the ankle, but then didn't travel up the whole leg. It cracked the fibula and sort of stopped that from becoming a bad high ankle soft tissue injury. So that's where they're sort of backing off. Initially, they said he was done for the season, and now he's actually seeing the guy who takes care of the Carolina Panthers, Bob Anderson, great foot and ankle guy. I know him personally.
Wow.
And he is the go-to for all these really high-level athletes for their ankle injuries. And the jury's out, but it sounds like they think because it's a bone injury, that has a chance to heal with just time and some immobilization, no surgery, and maybe back for the playoffs. And they would love to have him. He is I believe, the number one producer as a tight end in the last couple of years.
Yeah, and the Ravens are looking good. They're playoff bound. They need him. So we're in week 12, 18 weeks in the season plus playoffs. So you think he's out at least 4 to 6 weeks? What do you think? In here, I mean, that's amazing. Dr. Bob Anderson, but what do you think? What do you think is going to go on here?
Yeah, I think if he comes away from seeing Dr. Anderson with the plan to not need surgery, I think 6 weeks. 6 weeks and he'll be back out. Yep.
Yeah, let me just ask you a question because I admire this guy. This guy is an amazing athlete, but he also battles diabetes. I mean, I think he actually, if this is Mark Andrews, the one I've read about, he actually takes insulin during the game, if I remember. Am I on the right Mark Andrews?
No, yep, you've got the right guy.
Well, okay, so talk about that in healing, a diabetic in healing. I mean, is he going to heal as fast as a non-diabetic person? I mean, any thoughts on that?
Yeah, a lot of it comes down to your control of your diabetes.
Yep.
Now, one of those medical things, and these are the terms that start to make us orthopedic surgeons get headaches.
Yeah.
But talking about hemoglobin A1C is a way that they can measure how good you are about sort of controlling your blood glucose over time. So you can be a really bad diabetic, meaning like you need insulin, you've got a pancreas that isn't functioning well. But if you control your hemoglobin A1C and you keep it in a good range, like 5.5 range, you're able to heal just as well as a regular person. Yep. If you're somebody who comes in and you've got this hemoglobin A1C that's like 10, 11, and 12, we're starting to not even do sort of like semi-elective surgery on these patients that say have rotator cuff tears and things like that because of exactly what you voiced, the concern about soft tissue healing. You could do a great job of fixing something, but if they have poor diabetic control, small blood vessels are not in good shape. And so your ability to stimulate a healing response is just not very good.
Yeah, I mean, I'm sure he's one of those athletes that, I mean, obviously he takes care of himself. So we're looking at he's out. Mark Andrews, tight end, Baltimore Ravens, out for at least 6 weeks, but we'll keep an eye on him. And we only wish him the best because, he's great tight end. Luke Musgrave, Luke Musgrave, another tight end, Green Bay Packers. Sounds like he had an abdominal pain. Was hit, took probably a pretty big hit. They ended up up doing a workup on him, and lo and behold, he's got a lacerated kidney, and can't play with a lacerated kidney. I mean, is this season ending? I mean, this is pretty severe.
Yeah, obviously it's the degree of injury, I guess. I've seen two of these in my career taking care of football players, both at the high school level. Jeez. And they were both really hard hits and, sort of vague abdominal pain afterwards. And then unfortunately, a lot of times, I mean, obviously the advanced imaging can happen, but one of them, the guy was unfortunately, he had to go to the bathroom and there was blood in his urine.
I was just going to say, yep.
Yeah. So, that's the good news is the kidneys are pretty resilient. And so as long as there's not like a large hematoma, collection of blood around the kidney, as long as the the kidney function tests get better, it's probably just a couple of weeks for him to come back. But I'm speculating a bit on that. I've only seen a few of those over time, but he's definitely a sit this week. And I'd probably see, if he starts practicing in a week, then he'll probably be back in 2 to 3 weeks or so.
Yeah, it just kind of reminds us the collision and the force of the collisions and the contact that these athletes are sustaining and going through. And when you watch these games, it's amazing. I mean, it's just amazing. They do it play after play after play. And then we look at our pages of injuries and stuff. I mean, it's pretty amazing. It really is. I mean, but he is going to be out at least this week, like you said. Keep an eye on him. Only wish him the best. We talked about Kyren Williams. He's going to be a start coming back from IR. And that is it, folks. That is all our athletes, NFL players that were injured last week, talking about week 12. Again, we want to wish everybody a great Thanksgiving. Enjoy your time. And turn your scales back 15 pounds. I mean, that's what I would do, right? I mean,
exactly.
Dr. Hawkins.
Don't weigh yourself today.
Yeah, no, exactly. You have a great Thanksgiving with you and your family. I've always, like I said, like I always say, I always enjoy doing this. I learned so much. It's such a pleasure talking to you and your insight and your experience, your expertise in sports medicine, orthopedics, fascinating stuff. Thanks a lot. Okay.
Thank you, Shannon. Take care now.
You bet. Bye-bye.